It's a good sign, right?
That's a great sign.
Getting back to deals that make sense.
Deals that make sense.
All right. Jim's going to be with us again for the rest of the program.
The Congressman is here. The battle over health care reform headed for a weekend vote. Joining us now, Congressman Charles Boustany, member of the Ways and Means Committee. Do you have a feel for where we are? Is it we're hearing less than 10 need to be turned? Will that happen?
Well, the vote count is still very fluid, and we'll have to see what happens. You know, things are changing hour to hour as we go. But what's clear right now is that the votes are not there, and that's why we haven't had a vote yet on this bill. But keep in mind, the American people have rejected this bill. They've rejected this approach, and for good reason. You know, if you look at it, premiums are going to continue to rise for families and for small businesses. The bill is a massive tax increase across the board on small businesses, on families, with penalties in place. And there are a number of accounting gimmicks in this that really don't add up. And in fact, if you really look at the math, this bill is going to add $582 billion to the deficit in the first 10 years.
Congressman, everybody's got a poll that they cite. You just said that it's been rejected by the American people. The recent one I saw was, I don't know, it was pretty close. If you ask it a certain way, we should do this or not do anything, it was 48-47. Why do you just make that statement that it's been rejected by the American people?
Well, if you look at the vast number of polls, most of these polls demonstrate a clear break in opposition to the bill. But let me tell you, the people I'm hearing from across the board, whether from my home state or from other states, clearly are voicing strong opposition, and for very good reason. You know, this bill robs the Medicare program of over $500 billion to create a new entitlement program. And this, you know, we have a Medicare program that's already in trouble. Seniors are very, very upset about this.
Yeah, sometimes I hear that when Republicans start selling the benefits of Medicare and saying we can't cut Medicare, that almost that sounds like a switch from where they were when Medicare was first passed.
Well, you know, I'm a doctor. I spent 20 years practicing medicine, doing open heart surgery, and dealt day by day with Medicare patients and saw the difficulties they're faced with, oftentimes getting access to a primary care doctor and other types of health care. The program's important. It helps so many people. And to simply rob this program to create a new massive entitlement, which is going to run up further deficits, makes no sense to me at all. And that's why the seniors who are looking at this very closely are very upset. They don't like what they see.
Take me through what you think the most likely scenario is. So on Sunday, let's say they get exactly, the Democrats get 216. Then do you have any question that the Senate, if it's changed too much, will they just rubber stamp this? How do you think the process goes?
Well, if this bill does go for a vote and passes in the House, then clearly it goes back to the Senate because changes have been made to the Senate bill. And I would urge and caution my Democratic colleagues to consider that the Senate may just send the Senate bill to the President and call it a day. That's a real risk. And there's a huge lack of trust between House and Senate Democrats right now that needs to be bridged if they're going to do this. I can tell you Republicans on the Senate side are going to look very hard at this and raise points of order on this reconciliation package, because if you look at the numbers, it really does raise the deficit. It does not meet pay-go, and that's going to be a real problem. And so I would urge the House Democrats to be cautious in this and to take a step back. We can get health care reform right if we take a step back and do what the American people really want us to do, and that is go step by step with an eye toward a comprehensive reform bill, but get it right. It's so important to get this right because we're dealing with major fiscal problems in this country, and if we allow this to go forward, I think it's going to be a disaster, not only fiscally, but for health care, for seniors, for American families.
Before we can do that, we got to deal with the bill we have in front of us. Bart Stupak on one of the morning shows this morning says, protect the sanctity of life and keep current law. No public funding for abortion. That's been his longtime stance. But he also said, let's keep that principle intact. Then you could probably get our votes. Probably. Do you think he and his caucus are going to come around for the Democrats?
I think there are a handful of Democrats following Bart Stupak's leadership who consider this abortion language really going too far in the bill. And so I think they're going to continue to oppose the bill unless that language were changed. And there's no indication that the House is going to change the abortion language, the Senate language.
One of the things you've been talking about is and I don't think we've touched on this, the IRS in the bill, they can garnish tax returns if you don't purchase government-approved insurance. Is that something that you think increases the power of the IRS too much?
Of course it does. I'm the ranking Republican on the Oversight Subcommittee, and we had a hearing on this earlier in the week. And what became clear is that this is a vast expansion of the IRS reach into the American family's pocketbook. And let me explain what happens with this. We have an estimate that shows that, and this is a CBO estimate, that it'll be another $10 billion to beef up IRS, probably to the tune of 16,500 new employees by the IRS, and they have the authority under this bill month by month to ensure the compliance with the individual mandate and to enforce penalties. So they could garner your tax refund. They could put a levy on you. They could increase audits under current law and under the law proposed in the Senate. This is a huge expansion of IRS authority on a social program well beyond its usual function. And not only that, this $10 billion of discretionary spending, meaning annual appropriations, is not included in the cost of the bill. Likewise, with HHS, there's going to be a huge expansion of employees to deal with this new program. That discretionary spending annually is not included in the cost of the bill. And also there's some grant programs not included in the annual discretionary spending. That all adds up to about $100 billion in the first 10 years. That's cost not considered by the CBO, and they admit it at this point because they say it's a preliminary estimate that they have.
We're looking at 20-year estimates of deficit reduction. We're looking at a lot of things out a long way. Do you get the feeling that this will be, if it passes, this will be what we stick with, or is this a stepwise fashion, or will unintended consequences result in us getting closer and closer to single payer?
Well, I think there are going to be major unintended consequences in this bill because it's so loosely crafted. There are a number of flaws in it. Clearly, as a physician who understands how the healthcare system works in great detail, I've looked at this and I see huge problems going forward. And if it passes, I know my work is going to be extensive in trying to deal with the problems that this is going to create. And we already have problems with Medicare, and we need to fix those problems. We have problems with Medicaid. These programs are really budget busters right now. The quality of care is not what it needs to be. As a physician, I've seen it firsthand. And now we're going to build off of that same kind of model and create a whole new entitlement. It makes no sense to me at all.
All right, Congressman, Doctor, we appreciate it
Thank you.
this morning, and we'll be watching. Well, maybe watching some basketball, too, but we'll be watching.
What will you watch? Will you watch C-SPAN or...
You guys didn't give me kudos at all when Congressman Leader Hoyer came on. I said, wow, we've got some real exciting March Madness.
Oh, that was a good line. And plus we've got
a basketball tournament as well.
I think the March Madness is really what's going on here in Congress.
Nobody gave me a high five, kudos, nothing.
Hoyer laughed. He thought it was very funny.
I had heard March Madness on the Hill. I mean, I had heard that phrase earlier this week.
Oh, BS. You did not. I came up with that. I came up with that. Thank you.